Today what we're going to be talking about is going to be the lumbar and sacral and ilium subluxation and how it intimately relates to that lower rib subluxation. So if you're just adjusting lower spine and lumbars, ilium, and then sacrum, the ribs have to be adjusted, hands down. If you do not do that, your patients will not get well as fast. They'll still get better. You're just not going to completely get rid of the problem, especially when someone has an acute problem, like really, really acute. And then also chronic problems, also extremely beneficial when you adjust ribs along with low back issues. What I'm going to do now is I'm going to check her SI joints, and so that is going to be the foundation of a low back problem. So what we're going to do is we're going to go under the PSIS, and we're going to have the patient lean forward. So go ahead and lean forward. So you see how that right side pulls up, and so when we're done with the adjustment in this complex, you're going to see that that stays balanced. So just for your butt can't kind of came off the table, so just so it doesn't look like we're fudging it. So go ahead and bend above, and so you can see how that lifts up. So that hip is stuck and it's tractioning all that tissue up. It's going to allow for this not to move, causing pain. The second part of that is going to be that we're going to check the ribs, straighten your back, and then what we're going to do is we're going to rotate, and then we're going to rotate. So she has restriction on really both sides, and you'll see that her range of motion is really restricted on both. We're going to post check, and I'm going to show you that after. It's restricted on both. So what we're going to start off with is I'm going to have Peyton lay on her right side. Typically, you could have a patient lay on the side that the subluxation is up, but for angle reasons, we are going to do it this way today. So lay on your right side. And so what I'm going to do, so like I said, if a subluxation is down, all you have to do is you have to isolate a little bit different in that side posture position. You have to take out that lumbar curve, and then, you have to take out that lumbar curve, and then what I want to do, isolate it. I'm going to roll her a good bit because I'm trying to get that right SI to move. Okay, that was awesome. And then I'm going to have you go, kind of do the other side too. Okay. Oh, so sorry. And then, all right. And then go face. Okay, so now here what we're gonna do is we got the sacrum, lumbar spine, and then SI joints to move better. Now what we're gonna do is we're gonna hold that ASIS. Don't dig your fingers into their side, and then you're just gonna give a light thrust. And you can hear those ribs move, and it is very satisfying to me. But it will also be very satisfying to the patient. Okay, I know that was a little tender. So what you can do now is have the patient go ahead and flip over. Okay, so that subluxation was on this SI joint. You want to also check that femur joint. So in other videos we showed you how to do this, but you get that joint and you scour it. It's pretty tender, right? Mm-hmm. From there to about there, yeah. So what I'm going to do is I'm going to use the drop again. So I'm going to go here. We're going to go here, put my hands into that femur, and then I'm going to lift you up and then come back down. All right, do it again. So for this one, we're going to bring you here, and then I'm going to use here and here to adjust. Okay, right. And then that was very different. That was awesome. It's still pretty tight here, and I imagine that's your quads tight. So accessory problem to this would be that quad is tight, and it ties into that anterior part of that hip. So that is going to be another video or another problem that you'll have to tune in later for. What you can also do, lay face that way. Let's just show what we're gonna do. You can get the lateral part of that femur joint and then put your hand there into that femur. When someone has low back pain, they're gonna have, it's gonna be a regional problem. So that region is the sacrum, the lumbar spine, the ilium, the lower ribs, and then the femur joint. You need to check all of those things for a lumbar problem. So what I did is I adjusted them in side posture. I checked lower ribs, got those to move, got the femur joint to move, and then that is what I would do for that specific problem. Now, obviously what I would do is check the rest of the spine, make sure everything was moving, and that is always going to be primary when you get into making sure that the core or the spine is adjusted, then getting into the extremities. I would then go check her knee and her ankle and just make sure everything was good there too. Thank you so much for tuning in. We are going to go over more adjustments and how these other problems like the knee and the ankle and then moving up the spine in further videos, and then also in our upcoming seminar. Thank you so much.